Hi, this is Brian Brandon, and I'm here with Santosh Kumar, Wendy Nilsson, and Manny Srivastava, and we are going to talk about mobile health systems. Santosh, could you please provide a brief overview of your article?
Yeah, so this is Santosh Kumar from University of Memphis. Mobile health article that we wrote for the IEEE Computer Magazine provides an overview of this newly emerging area where healthcare needs can be met through mobile technologies. And this article provides both the new emerging opportunities as well as the research challenges that underlie the mobile health discipline. And it provides an overview of the various technical challenges and various other challenges like the privacy and security that surround mobile health. So to provide a brief overview of mobile health basically refers to having technology helping people lead healthier lives. It's already being adopted by several practitioners and caregivers to have better connectivity with their patients and improving communication among them, providing remote access and always available access to their healthcare data. But this is only the tip of the iceberg. Mobile health represents an enormous opportunity, especially at a time when we are facing a healthcare crisis with burgeoning, exploding healthcare costs. The real opportunity comes from three new capabilities. First capability is being able to collect health-related data on a continuous basis right in the natural environment of people. So not just in the doctor's office, the data can be collected on the go right where people live and spend their lives in. The second new capability is that using this enormous amount of clinically relevant data to be able to automatically make inferences on the health and behavioral status of individuals and use that to inform treatments and interventions. The third major capability is because the mobile device stays with the person most of the time, that being able to design and deliver interventions right there when and where they are needed, to be able to deliver interventions right at the most vulnerable moments and use this capability of being always with the person to help people adhere to treatment protocols. So as people have known, with this enormous opportunity also comes great challenges. So not only do we have research challenges in developing these capabilities, but also in making sure that these capabilities, which can have health impact on health decisions as well as life and death decisions, they are well validated and they do what they claim to do, that they preserve the privacy of people because the data and decisions are made in the natural environment of people, and that they are appropriately regulated. So this article describes the challenges and emerging opportunities in each of these areas.
Thank you, Santosh. Wendy, what are the primary research impediments toward realizing mobile health systems?
I think that's a really interesting question because mobile health is a very novel area. For the mobility is not a new thing, but when it comes to health, it's a very new area. As Santosh really talked about, there's been some real changes in the way we think about health, and bringing health to people in their homes, in their communities, where they live is a very novel way of thinking about it. So the research challenges really have to do with that. First, there's some of the challenges around devices, building devices that are measuring things that we've never been able to measure before well. So one of the problems becomes if we don't really know how to measure it well, what do we use for the ground truth? What is our standard going to be? I think it's a good problem that we can now measure better, but we really do need to build on what's been done before, so we're really working through that. The other thing is some of the designs that are used to evaluate health has some different implications than many other computing science areas, and so we have to worry about safety, and we have to worry about efficacy. Does this work? And is there a risk to people of a failure, of a lack of communication, a lack of the device functioning. So in standard health research, the ground truth is a randomized clinical trial where we assign people at the very beginning a relatively large number. We assign them to either to a control condition or a treatment condition, or there might either be two conditions. These have traditionally been very big, very expensive, and average between 5 to 5.5 years between when they're actually funded and when they start to publish. And as you might imagine, in a rapidly changing technology area, that's a real challenge. The technology has been outdated well before these interventions have ever been evaluated. So there's a real challenge there, although there are new methodologies being developed that really can help us. And I think there's a real belief that in mobile health, we can use the data that's streaming in help us. As Santosh said, we can improve adherence to these treatments. We can monitor people better. We'll be collecting in traditional health studies. We only collected data when we saw people, when they came to the clinic, or when they were at the hospital. Now we can collect data day in, day out in their real lives. So there's a real thought that we can reduce the times of these trials and make them much more efficient. We also know that there's some other trial designs that we should be using. There's something called an N-of-1 design that lets us use, a single subject as if they're a comparison group, a single person. And those, if they're done well, really can be helpful in developing and really beginning to test things. So I think when we put these things together, there's a lot of work in this area. It's a lot of growth. I think there's lots of opportunities. But these present challenges right now, especially in the safety issues, because often some of the challenges in computer science in developing things are very different in the health world. And a system might, you might have a concern about a battery life, but not about a battery heating in an older person who's wearing something that might be flammable. These are things that we really need to think about now, and they make some different challenges, but they make opportunities too.
Okay. Can you discuss how the design in Trustworthy in-health systems requires extensive collaboration between computing, engineering, and healthcare researchers?
Yes, it obviously, I think there's a point when you think about this is health researchers are not trained in computer science. They don't understand it. They may have a high-level version of what's happening, but they don't understand what's really happening. And as in the health system, understanding what's happening in the health system, I was at a recent meeting and people were talking about human subjects, and if you've never worked in a human subject environment, which is the safeties that are put on research using humans, which is all of health research for the most part, it's a very different thing. But I think so. We really needed to make it work, but I think we actually really needed to make it work well. If you just bring one team talking to themselves about these things, I think that's what we have in health. We've been working with each other. We now need to bring in new people and think about this. And so these collaborative teams will go beyond the knowledge of their individual members and really optimize mobile health. I mean, it's a challenge because we need to learn to speak the same languages. You may talk ground truth, I may talk gold standard, but we're talking the same language. But as we get to learn to talk together, I think this is an incredible opportunity, and it lets all of us use our skills in ways that have never been able to be done before.
Okay. What are the short and long-term prospects for in-health systems, and when can we expect to see their widespread adoption and use?
There are lots of opportunities on the short-term horizon. Several sensing capabilities that already exist today. They include assessing and measuring physical activity in the mobile environment and using that to encourage a greater amount of daily activities that can help address obesity, diabetes, and a whole host of other lack of activity or sedentary diseases. We are also started to see physiological sensing emerge that can again be done in the natural environment, and healthcare providers are already able to see physiological measurement data available from the natural environment. In the longer term, we expect lots of new sensing capabilities to emerge that may make it possible to detect in time several health-related conditions that are not possible today. And some of this can be related to the cardiovascular diseases, and in the longer term related to other chronic diseases such as hypertension, diabetes, and others. In terms of when we might be able to see these capabilities of widespread adoption, I would expect more adoption in half a decade or by the end of this decade. So by 2020, I would expect widespread adoption of mobile health technologies for health diagnostics, health improvement, and care delivery.
So if I may add to what Santosh just said, so I think there are a set of low-hanging fruits, if you may, where technology is there, and I think working with the medical practitioners, they're sort of ready to get deployed as soon as some of the regulatory issues and all get ironed out. So, for example, just recently, FDA gave 510K approval to one of the ECG devices for use with iPhones. But at the same time, I think currently there are technology limitations as well, which will get sorted out over a somewhat longer time duration that Santosh referred to. So, for example, a lot of sensing modalities right now are kind of burdensome on the users, in the sense you have to strap things on, for example, so it's just onerous to use. So I think one direction you'll probably see is sensing technologies themselves evolve, driven by these needs, so contactless sensing, for example. Probably the other thing that you will see also is mobile devices themselves, which are currently, these were designed to be originally communication devices. So as we have begun to kind of use them for this kind of 24/7 personal sensing, we are kind of stressing them in ways that wasn't thought. One of the ways really is energy. I mean, having these sensors operate all the time puts a burden on these devices which they weren't geared for. So you'll see a fair bit of technology innovation also sort of happening to kind of make these longer-term uses pan out as well. Another direction you'll probably see is that it's not simply about capturing the sensor data, but also analyzing it, sort of computationally analyzing it automatically, perhaps using cloud services, because otherwise you'll have this deluge of data which sort of the medical side will not be able to cope with effectively. So I think on the longer time horizon, you're going to see both sort of sensors and mobile devices, as well as how we process and handle the massive amount of data, all of these things coming into play, and that probably is 5 to 10 years out in terms of wide-scale deployment.
Okay. Santosh, Wendy, and Manny, thank you very much. Thank you for taking the time to speak with us about this, and we look forward to following along with your research as it develops.
Thank you, Brian.
Thank you. Appreciate it.